State College of Nursing, BSN2C. So I'm going to perform sputum specimen collection. So for the assessment, areas point to be assessed during sputum specimen collection, assess the overall health of the client related to the test being conducted, assess the need of the collection of the sputum, assess the need for PPE. For the planning, prepare all the equipment needed, sage and bag, sterile specimen bottle, kidney basin, clean gloves, mask, and goggles, transport container. For the implementation, prior to performing the procedure, introduce self and verify the client's identity, explain to the client what you are going to do, why it is necessary, and how he or she can participate. Good day, ma'am. I'm Desi Velasco, your student nurse for today. May I know your name?
Shaira Gulpad po.
Age po?
20.
Birthday?
August 24, 2000.
Okay, thank you po, ma'am. So, the procedure that we are going today is the sputum collection. This is to identify the bacterial, viral, or fungal cause of a suspected infection and its sensitivities to antibiotics. A specimen is indicated if patient has clinical signs of infection, including a productive cough and purulent sputum, signs of systemic infection, and pyrexia of unknown origin. So, naiintindihan niyo po ba?
Yes.
So, pwede na po tayo mag-proceed. Thank you po. So, we need to perform hand hygiene and observe appropriate infection control procedures. If the client can perform the task without assistance after the instructions, call out the nurse, healthcare provider as soon as the specimen is produced or available. Check the specimen label with the client's identification. The label should include the client name, identification number, time specimen was collected, route of collection, identification of the person obtaining the sample. And then put on disposable gloves and goggles. Place client in semi-Fowler's position, have RGA client clear nose and throat and rinse the mouth with the water before beginning the procedure. So usually the specimen collection is being done early in the morning before having breakfast. So ma'am, let me assist you in semi-Fowler position po. Thank you po. Ma'am, using this water, rinse your mouth. Ask the client to breathe deeply and then cough up 1 to 2 teaspoons or 4 to 10 ml of sputum. For acid fast bacillus, which is also requires the following collection often for 3 consecutive days to identify the presence of tuberculosis. So ma'am, this is a sterile container. Dito nyo po ilalagay ang inyong sputum and not the saliva. So you need to cough 3 times coming from your lungs. So para po mag-produce ng sputum. So ma'am, remind ko lang po na before you cough, you need to breathe 3 times deeply. Thank you po. If the client procedures sputum, open the lid to the container and have the client expectorate the specimen into the container. So follow these special precautions if tuberculosis is suspected of obtaining the specimen. Ask the client to expectorate the sputum into the specimen container and make sure the sputum does not contact the outside of the box. If the outside of the container does become contaminated, wash it with a disinfectant. So remove equipment and return the client to a position of comfort. Remove goggles and perform hand hygiene. So ma'am, I'm going to assist you in your comfort position. Thank you po. Next, place labels on the container per facility policy. Place container in plastic, sealable, biohazard bag, and or transport container. Remove the other PPE if used and perform hand hygiene. Before put back all the materials in the bag, we need to sanitize or alcoholize them. Then open the bag and put back all the materials that we needed. Fold the plastic lining properly and put back to the bag. And then close the bag. And fold the paper lining and place it in the bag. So this is the sputum specimen. So we need to seal properly the biohazard and transport immediately to the laboratory. For the evaluation, we assess and evaluate the comfort of the client after the nursing care. Transport the specimen to the laboratory immediately. If immediate transport is not possible, check with laboratory personnel or policy manual whether refrigeration is contraindicated. For the documentation, document the collection of the sputum specimen on the client's chart. Include the amount, color, consistency, thick, tenacious, water, and presence of hemoptysis, blood in the sputum, the odor of the sputum, any measures needed to obtain the specimen, example, postural drainage, and any discomfort experienced by the client. Record findings and nursing care is given, and make an appointment either for a clinic or home visit. And that's all. Thank you for watching.